Good evening, one and all, to this live stream of Doc Talk presented by SL Raheja Hospital, a Fortis associate. Today, we have with us Dr. Rakesh Dhake, a consultant spine surgeon at SL Raheja Hospital, a Fortis associate. Dr. Dhake has done his MBBS and MS in orthopedics from Bombay itself. He's no, he's a fellow at Nottingham Advanced Spine Fellowship at Queen's Medical Centre, UK. He's a senior clinical fellowship at Royal College of Surgeons, England, UK. Spine fellowship from Indo-American Spine Alliance, Park Clinic, USA and India, and he is a visiting spine fellow in Portugal and Budapest, Hungary. So I'll just quickly go through. Dr. Dhake is with us to quickly go through a few questions and that we will be asking, and we'll hope to get some response from valuable response from Dr. Dhake. Sir.
Hello, good evening. Thank you so much for the introduction. So, we are going to discuss today about lower back pain, what causes the lower back pain, and what are the treatment options. How can we stay away from back pain? What are the changes in our lifestyle we can do? So, yes, you can ask me something basic related to what comes to your mind, and we can go through it.
Sure, sir. So we'll go with the basics. Basics being what are like how common and what are like the causes of back pain. So how common is lower back pain among the general population as such?
Now, if you'll be surprised that almost everyone in their lifetime will have almost 60 to 80% of such of all of us will have back pain at some point in their lifetime. So, at least 80% people will have to visit a spine specialist for their back pain once in their lifetime. It is that common. And that is the second most common cause for public to visit doctors. Okay, so and also given the lifestyle these days, very much sedentary job and long sitting hours also increases the incidence of back pain. So we are very commonly seeing back pain these days, especially people who sit for long hours or who lift like heavy lifters also. So yes, it is very common, or at least 60 to 80%, I would say.
Sure, sir. All right. And who are the people at risk, or what are the risk factors associated with lower back pain as such? If you could just imply.
So see, the risk factors are, I mean, we all know that we should sit straight, we should bend straight. Now, however, despite of knowing all of these things, sometimes people they have their work uh, demand so that they have long sitting hours and they're not able to maintain their posture straight. So yes, long sitting definitely predisposes to more incidence of back pain. And it is said that smoking is like a new smoking. So as much as damage that smoking does to your lungs, sitting can do that much of damage to your spine. So prolonged sitting hours definitely predisposes to back pain. Then other thing is lifting heavy objects inappropriately. That can be at work, that can be at gym. So even people who go to gym, when they don't maintain their form properly, especially during squatting or lifting anything from the floor, these patient population are also increasingly predisposed to back pain. Now, also like especially these group of people, again as I said, long sitting are especially software engineer and those into the IT industry. They also have increased incidence of back pain. So usually these are the two common groups of people. Then there is age-related back pain, which is degeneration. So wear and tear, as we all age, our hair go white, our skin wrinkles, so does your spine, which degenerates. There is wear and tear happening in your spine. So as we age, incidence of back pain increases, and that wear and tear also predisposed to back pain. So elderly patients, mostly more than 40 years of, even now, like I said, younger population also is getting back pain, but degeneration in elderly population can also result in back pain.
Sure. Yeah. Yeah. The younger population and older age also plays a lot of role into contributing to lower back pain. So, we've covered the risk factors. If we could just dive deep into the causes of lower back pain, if we could just go through.
Now, see, causes wise, mostly the causes are, like I said, related to the lifestyle. Uh, if it is acute, meaning you have someone has a back pain for last like a week or 4 5 days, then they have done something not correctly. They've bent or they've lifted something inappropriately that has caused their muscle to go into spasm or their disc to prolapse. This is one of the commonest cause, but amongst the younger population. But if you look at the elderly population, their back pain usually is due to degeneration. So disc can pop out, or there can be wear and tear causing stenosis or degenerative disc disease, meaning the disc which is juicy and which is meant to absorb the shocks degenerates, becomes hardened, loses the softness, and then that doesn't conduct the shock correctly, and that can also cause back pain. Now, these are the common causes which we usually treat with medicines and physiotherapy. We'll discuss in the treatment part. But other rare causes which are little worrisome are infection and tumor. So if someone has back pain along with constitutional symptoms like weight loss, fever, loss of appetite, night pains, then these group of patients are likely to have infection or tumors in the spine. Okay, so the common causes you can summarize as lifestyle related, long-term sitting, then age related, which is stenosis, disc herniation, the common problem, the infections and tumors. These are the common problems. Sometimes due to osteoporosis, the spine weakens, like all your bones weaken due to osteoporosis, so does the spine. And sometimes there is no clear history of trauma. So these elderly population, when they even sit with a sudden impact or they sneeze or they cough, even that much can be enough for them to cause a spinal fracture, which can then result in pain. And you don't get a clear history. So only on investigation you can find out that there is a compression fracture in the spine because of osteoporosis. Again, that is one of the common cause in elderly to have back pain. Overall, also loss of vitamin D and calcium, deficiency in vitamin D, calcium also can cause generalized pains in the body. So these are the common causes of back pain.
So yeah, we've basically covered nutrients and supplementation. So vitamin D and calcium, and then sedentary lifestyle. So all these are major contributors to
Yes.
causing lower back pain. Understood. So you were mentioning about investigations that would help diagnose what exactly lower back pain and why is it being caused. So if you could just elaborate on what investigations that lead to the diagnosis of the better diagnosis of the disease.
Now, see, when the patient comes to us, the most easily obtainable investigation is to get an X-ray scan. Most of the clinics have an X-ray machine, so we usually get X-ray scan in like 5 minutes, and X-ray will give you a rough idea as to how is the spinal alignment, what is the arrangement of bones like. We usually have this curve in the lumbar spine, which we call as lordosis in our language, but this curve can be reversed or the spine can be straight due to spasm of the muscle. So if the muscles get tight, that reduces the curve of the spine and it can look straight on the X-ray. Other thing is if there is any slippage of the vertebra, which we call as listhesis in our language, so that slippage also can be seen in the X-ray. Other thing that X-ray tells us is compression fracture of the vertebra. So as I said, in elderly population osteoporosis, we can come to know on X-ray, as simple investigation as X-ray, that there is reduction in the height of the vertebra, there is a fracture. Other thing we can also get an idea on X-ray is if there is any infection, like TB is the most common in our country. TB usually starts in the disc. So the disc will be destroyed and the vertebra height will be reduced. So all these basic ideas we can get on X-ray. But if there is a soft tissue lesion like a disc herniation or sciatica related due to pressure of disc on the nerve, we don't see on X-ray. X-ray will give you only bony idea. So to get a soft tissue idea as to whether a disc is prolapsed, whether nerve is compressing, whether spinal cord is compressing, we need to get an MRI scan. So second most common investigation we as spine specialist order is MRI scan. Now, MRI scan will tell you all the details. It will tell you what is the disc like. If the disc is completely black, it means it is dried out. It has lost its water content. It has lost its juiciness. If the disc is coming out, it is prolapsed, whether it is pressing on the nerve. If it is, then that can cause radiating pain down from the buttocks all the way down the leg, depending on which nerve is pressed. If it is pressing on both the sides, then the patient will have pain down both the legs. If it is pressing on one side, then that side pain patient will have. Then if there is again infection or tumor, that also is very clearly evident in the MRI scan. So MRI scan gives us 90 to 95% of details that we want to see to come to a diagnosis. Sometimes we especially want to look at the bony anatomy. Like suppose someone has had a fracture, they had a fall from height or road traffic accident, they have injured their spine. And we want to assess the stability of the spine. If there is any bony injury, sometimes MRI doesn't give us that fine detail of the bony anatomy. So when we want to look at the bones in detail, we order a CT scan. Sometimes in such patients like trauma, we need both MRI and CT. MRI will tell us the cord or nerves anatomy, and the CT will tell us the bony anatomy. So these three are the commonest investigation we order in spine surgery. Now, in elderly population, if they are osteoporotic, as is evident most probably on X-ray, we can't say on X-ray for sure they are osteoporotic, but to quantify that how weak their bones are, we order something called DEXA scan. Now, DEXA scan tells us objectively how strong or how weak the bone is. So we order a DEXA scan, and if it is weak, then we start treatment for osteoporosis. So, yeah, investigation wise, radiologically, we order these four. Now, blood investigations that we require in back pain patients, if we are suspecting infection, then we order their WBC count or complete blood count, you can say. And if there is rise in WBC or neutrophils, that points towards infection. We also order ESR and CRP. If CRP is raised, that also tells us that this patient has an infection. So these are the basic investigations that we usually ask for in our back pain patients.
So, in summation, so we've covered X-ray, that is like the preliminary diagnostic way to get to a diagnosis. Then you go into an MRI and CT, DEXA for older patients, and then blood investigations as necessary.
Yes.
So, yes. So, once we're done with the investigations, we've covered the investigations. Now, before the investigations, the patient might have some sort of pain or some sort of characteristic feature, right? So, what exactly should what exactly should be looked after? What are like some sort of red flags, or when should a person be worried, and when to visit the doctor, so as to say?
Like we discussed, back pain is a very common thing, but not always you might want to go to the doctor, because sometimes you might think it is a muscle spasm and it can get cured by hot fermentation and over the counter painkillers. But when your back pain is persistent and it is accompanied with radiating pain down your leg, which we call sciatica in the common language, sciatica along with constitutional symptoms like weight loss, fever, loss of appetite, these symptoms definitely are a red flag. You need to visit a spine specialist. If you don't have weight loss and all of these, but you have something like disturbance in your private parts or perianal area, meaning when from where you pass urine and back passage area, when you clean during the toilet hours, during cleaning you don't feel sensation or you feel some weird sensation or numbness, or your control on the urine and back passage is compromised, meaning when you laugh, when you sneeze, you can't hold the urine, or you have to rush to the toilet to pass urine. All these are red flags. It means your nerves are getting compressed and you are losing the power below that level. So back pain with sciatica with disturbance in private parts and loss of control on urine and back passage are red flags, in which case you need to visit the doctor ASAP at the earliest you can. And the doctor usually then investigates you with an MRI scan to rule out the commonest emergency in spine, which is cauda equina syndrome, in which the lower back nerves are completely compressed, and whatever comes below that, what comes, your legs and your private parts and urine and back passage thing. Along with this, you may have weakness in your legs, which is your foot, sorry, your ankle, your big toe, or below your knee. If such weakness is associated with all of this, so even weakness is a red flag. So all these things warrant an urgent attention by a spine specialist, investigation by an MRI scan, and then an appropriate treatment based on whatever the scan shows. Because in such situation, you don't have enough time. Usually, the back pain patients are elective. They are sitting with pain for 3 months, 6 months. They visit some doctor, take over the counter medicines, and they pass their days. But if you have these symptoms that I mentioned, including urinary back passage and weakness in your legs, you shouldn't waste a single minute, and you should immediately go to the spine doctor and get yourself evaluated.
So basically, earlier the treatment, earlier the time you seek the treatment, the better it is. So even if
Yes.
you have these symptoms, as mentioned, for more than at least a day, or as soon as you have those symptoms, you should go and visit a doctor. Yeah,
Yes.
all right. So that covers the red flags and things to look after. Now we go into treatment. So what possible options are open to patients who have these sort of lower back pain issues? And if you could highlight a few.
Now, see, back pain patients, only I would say 5 to 10% of patients require an intervention like surgery. Majority of our patients don't need surgery. They usually get better with medicines and physiotherapy, along with some hot and cold fomentation, massage, or gel application, and all of these things. Now, if that is spasm in your lower back, we give you antispasmodic drugs along with painkillers for 3 to 5 days. We ask you to apply hot fomentation, local anesthetic gel, and rest for 2 3 days. That usually takes care of most of the conditions in acute cases. But if it is age related wear and tear, degeneration in the spine, these patients usually have back pain for long duration, for months and years. In such cases, again, we give some nerve related tablets if they have claudication or weakness in their sorry, or nerve related radiating pain in their legs. Then we give them nerve related medicines to reduce the pain, which is like pregabalin, gabapentin. And along with that, we want them to strengthen their core and back muscles. So if your core and back is strong, that is going to make you hold your spine straight. That is going to support your spine. So a good core and back muscle will give a good strength to your spine and hence reduce your pain. It is just like a belt that we wear. So if your muscles are strong, it is like a belt. It is an internal brace that you're applying. Belt is an external support. So your own muscles, nothing like it. Okay. So that is the usual mode of treatment. Now, after having physiotherapy, medicines, if the patient's pain is persistent, they have walking difficulty. They have to sit after 5 to 10 minutes because they get heaviness in their legs. They get pins and needles in their legs. Or if there is weakness or red flags that I mentioned, we immediately investigate it with an MRI scan. And if there is compression on the nerves, and in red flags cases, we need to immediately operate, relieve the pressure on the nerve. But if it is a long standing problem, like in elderly population, which is spinal stenosis, disc herniation, then if they have failed the conservative treatment, there is another option of injection where we put epidural injection or we put a transforaminal injection and inject only that nerve which is getting compressed. So that can help them relieve the pain in the leg and also back pain, but it is not a cure. It is going to give them a window of pain free few weeks or months wherein they try to reduce their weight, strengthen their core and back, change their ergonomics, do things properly, and then that can reduce their pain. If they have failed medicines, physiotherapy, failed injection, then the last option is surgery, wherein we remove the pressure on the nerve, and if there is any instability, then we have to fix it with screws and rods. So, spine surgery is a last resort when you have failed medicines, physiotherapy, and all other measures, and you continue to be in pain, and that is changing your lifestyle, meaning you want to do something, but you're not doing because you have so much of back pain and leg pain that medicines are not sufficing. Only then we take a call after discussing with the patient that considering surgery, the benefits are more than the risks, and in that case, we go ahead with surgery. So these are the treatments.
All right, sir. So basically, we start off with medication and physiotherapy. That is like the basics of getting to treat someone with lower back pain. Then we go into surgery. So
Yes.
surgery is also indicated when there's a very serious issue, like the red flags you've mentioned, nerve compression, and something that is altering your way of life regularly,
Yes.
activities that you do regularly, and you are not able to do them anymore because of something very serious. So that is when we come to the surgery part of it.
True.
Right. So, yes, coming back to the surgery and going on with the surgery, what are the chances of success, and how much does a surgery, that is a more common question because patients are very hesitant to go into surgery. That is what we've seen. So, what is like how successful is a spine surgery?
Yes, this is a very common question. Every patient you advise surgery asks us this, and I think it is a very justified question for anyone to ask if they're going to have surgery. Now, if you see, if you like 10, 15 years ago, most of the spine surgeries, even today, are done by neurosurgeons or orthopedic surgeons. Okay. Now, they are trained in doing everything. They do everything, and common spine surgeries also they do well. But now, spine surgery is so much specialized, and people like us from orthopedic background or neurosurgery background spend another 4 to 5 years training in spine surgery. So I feel if a specialist does the spine surgery, the results are slightly better, or because we do this every day. And if an orthopedic surgeon also does it well, we just need to know that you need to trust your doctor in that case. Okay, in all the cases, to be honest, you need to trust your doctor. First of all, that is a very important factor, because you will need to understand what is the problem, and then what are the solutions the doctor is offering you, and you should be making the decision for yourself, having understood what options are there, what is my problem, how much I am affected, and considering the risks and benefits. Does the benefit outweigh the risks? Only then the decision of surgery is made. Now, this is the background I'm giving you, because this background is very important. If you don't know why are you getting operated, what are the risks involved, sometimes spine may not be one and done job. Okay, so you might have spine surgery, you might have back pain, go on and off, on and off, and then you might regret having spine surgery. So these objectives should be very clear before you sign the consent form for spine surgery. Now, having done the surgery, what were the indications? Meaning, why was the surgery done? If surgery is done, like for a very tight stenosis, the nerves are compressed, you've been struggling with pain, you're not able to stand and walk for more than 5-10 minutes, I can confidently say that it is successful in 95% of patients, or more than 95% patients. So, patient selection is very important. 5% patients are those who have had nerve compression or problem for so many years, and they didn't go to the doctor, or they were just postponing their surgery. And in such 5% patients, the nerve compression has been there for such a long period that even if you remove the compression, majority of pain might go away, but they might have some persistent numbness or paresthesia, meaning weird sensation in their legs, burning sensation, pain in the foot, or numbness in the foot. And this numbness usually then stays even after surgery. So these patients might think, oh, I got operated, but I still have numbness in my legs. But you need to know that you presented so late. The simplest example I usually give is, if you tie a tight rubber band on my finger, very tight, and leave it for months, you come back, you remove the rubber band, you will see a mark on my finger. And then mark still has an indentation. The color is different. It is blue, it is white, it may turn black if it has been there for long duration. And then even if you remove the rubber band, it's not going to be like this immediately like the other finger. It takes time to heal. The problem with nerves is nerves don't heal very well. That is the reason why we see spinal cord injury patients paralyzed for lifetime. If you break a bone, the bone will unite. But if you damage a nerve, the nerve doesn't heal well. So, timely presentation to the doctor and timely intervention, if that is done, then the success rate is good. But if you're presenting yourself so late, then you can't blame the doctor or the surgery that the surgery wasn't successful. So, that is other thing. So, all in all, if the discussion happens good with the doctor and you understand the pathology well, why is the surgery done? Then I can say the success rate of surgery is very good, which is like 90 to 95% of patients.
All right, sir. So yeah, we've covered the success rate of the surgery. So basically, one should have the trust in their doctor. Firstly, secondly, the doctor has to basically tell them, depending on their arrival. As in, if you've presented with those symptoms and you've come earlier the better is what is
Yes.
the takeaway from this. So, and
Yes.
a really nice analogy with the rubber band on the finger. So that helps put a picture to a disorder. So
Yes.
normally you think of diseases and disorders, you don't have a picture. Now that you have an example, you have something that you have to keep in mind, and yeah, so you could take away from that. All right, sir. So we've completed a good amount of questions regarding treatment, regarding diagnosis, surgery, success rates, and everything. Just to wrap this all up, what are the take-home messages or takeaway messages that people watching this live stream could take away from all of this? If you could just sum it up once again for everybody.
Now, see, yes, like we all know, like I said to start at the start, you should sit proper, you should stand proper, you should bend properly. This is very important. Other thing to note is sitting is new smoking. So you shouldn't sit for more than 45 minutes at a stretch. Okay. What I mean by that is when you sit, your body weight or the gravity is putting weight on the discs. And if you look at the pressure on the discs, that is the least when you are flat. When your horizontal body weight is not acting, the gravity is not acting. So the pressure on the disc is least, which is 25 units. But when you sit, when you're vertical, your body weight is pressing on the disc. And that pressure can go as high as up to 150 units. So where is 25 and where is 150? That much of difference of pressure is there on the disc. And if you're constantly giving that much of pressure, people sit for 8 to 10 hours constantly working on their desk. So that is not good. So you should change that habit. After every 40 to 45 minutes, you should get up, have a little break, go to the toilet, have a sip of water, sit down, or do whatever you're doing standing. That is the first thing. Second thing is if you're driving for long hours, or even if you're sitting in the office chair for long hours, you should have a backrest. Backrest that accommodates your lumbar curve so that you don't do this after some time. You should be sitting straight so that your back is supported. Other thing is smoking. Smoking releases nicotine that causes constriction of the blood vessels, and therefore the nutrients that go to the disc and the spine are compromised. So smoking definitely can worsen your back pain. So if you have back pain, you should definitely quit smoking. Other thing is a healthy lifestyle, which means in taking whatever basic nutrients we need, like calcium, protein, is good for your bone health, and also vitamin C that increases collagen. So a healthy diet is as important as exercising. Now, exercising not to build a lot of muscles, but to have a basic tone in your body to support your core and your back. And like I said, if they are good, then your back will thank you for having a good muscle tone around it. And if weight is excessive, weight reduction is very, very important. More the weight, the spine has to do more work to keep you upright. So a weight reduction program, definitely, if you're obese, you need to start thinking seriously about weight reduction. If you don't have back pain now and you're still obese, you have to think of 10, 15 years down the line. If you keep on putting such weight, you are definitely going to have back pain in years to come. So you should take it seriously, reduce your weight. So just weight reduction, healthy diet, healthy posture, and exercising is what I would advise our audience for back pain. Stay away from back pain.
So yeah, so these are all the things that we need to do to stay away from back pain. Basically, it's just staying active, being aware of what is going on with you, more mainly, and then presenting early. The early you present to the hospital, even if it is a minor inconvenience, it's better, so that we can avoid any complications in the future. So any sort of black back pain you have, that is for a longer time, I think we should have a good look at it and then assess it ourselves first, and then go to the doctor, and then yeah, pursue whatever treatment and treatment options as we have discussed in this live stream. So yeah, that wraps up our session here. I'd like to thank Dr. Rakesh Dhake for a very insightful session. It was very insightful. It was very educating, and yeah, I hope a lot of people have taken home something with this. And yeah, so thank you so much, sir.
Most welcome. Thank you for inviting. Thank you.